Alright, so we're looking at the EMR Obstetric template. Alright, this is the electronic medical record for obstetrics. Right, so you just have to do it a way of documenting information. You attended to a woman when she was pregnant, when she gave birth, and shortly after she gave birth. How can you be able to keep this information very safe for her? Right, so they are just pre-designed digital forms. So we said they're electronic. It's not a physical thing. It's actually on the device. So we're just trying to look at, in this place, what are the things you mostly try to record. So they are pre-designed digital forms. They are used by obs and gynaes to document prenatal visits, labor and delivery, postpartum care, and other obstetric encounters. Just throughout that time of care, what actually happened. Right, you are trying to document. So this will help you if you are trying to attend to this woman the next time. This woman's common issues. If you want to even transfer the patient to another facility, you can be able to advise them on what you have done so far. So it streamlines clinical workflow by standardizing documentation. Right, any healthcare provider can access this information even 10 years later. Reduces manual entry, improves accuracy and compliance, supports billing and coding. Even if you want to come and charge the patient later for the care you gave to the patient, you can easily access what you did to the patient. Right, so this is an example, but let's quickly just look at the important things that you might actually but you can pause to observe this. Right, you can pause to observe this. So most of it should contain gravida and para. That's how many times the woman has actually been pregnant, right? How many children she has alive. Has she ever lost any child? They also have information on the LMP. That's the last menstrual period. So from the LMP, they can actually calculate what the EDD. That's the expected delivery date. You possibly know when this woman will give birth. Like for this woman, this was the possible time which she would give birth. All of that. Right, so prenatal visit. So as she's coming to visit, all those are blood pressure, right? How big her stomach is becoming, how the baby's heart is beating, all those lab results you'll be documenting, right? Then ultrasound, what you found on ultrasound, you also be documenting. Labor and delivery notes, all right? Then postpartum care. After she gave birth, was there bleeding? How did they stop the bleeding? How much blood did she lost? Breastfeeding and emotional health. All right. The risk assessment. You try to see if the woman had any issues, any complications while she was pregnant. Okay. So that's just it for what it is. Okay. That was what it is. This one, I was trying to talk about different platforms that have different templates. So you can check out CharmHealth. You can check out Acro EMR. You can check out the Next Gen Healthcare. So even if you need it and you don't know how to check it out, you can just comment. I'll guide you on that. Okay. So that's it for what this simply means.